Regulation of the vascular system to maintain a constant arterial pressure is critical in ensuring adequate perfusion to meet metabolic requirements of tissues. Acute regulatory mechanisms are coordinated in the cardiovascular control centers in the brainstem, which are themselves influenced by the impulses from other neural centers in addition to sensors both intrinsic and extrinsic to the circulation. Patel 2017 states that certain organs such as the heart, kidneys, and the brain have the ability to coordinate blood flow locally themselves, thus enabling alterations in regional perfusion without disturbances of BP. This mini presentation discusses neural and humoral mechanisms involved in systemic BP control. Maintaining adequate blood pressure for perfusion is achieved via two mechanisms, neural nerve control and humoral chemical endocrine control. Neural control is initiated by the cardiovascular central centers in the brainstem. It involves the innervation to the heart muscles via the peripheral nervous system, which decreases heart rate, and the sympathetic nervous system, which increases myocardial contraction and increased heart rate. The vasomotor center has an area with neurons secreting high concentrations of noradrenaline, and this is a good site for drug intervention. Peripheral vasculature affects tone of the internal muscular fibers. It is also regulated by calcium concentration. Other agents can mediate the effects via agonism and antagonism of these pathways. Vasomotor tone is affected by the ANS and other humoral agents. Vasodilation can arise from decreased SNS and increased PNS. ANS involves the heart by regulating inotropy and chronotropy done by the SNS, mainly through the ventricles. It is also done by the PNS via the synatrial and the anteroventricular nodes and the atria. This is achieved via the vagus nerve stimulation. Peripheral circulation. The SNS is important in regulating vascular tone by the stimulation of adrenic receptors, increasing blood pressure. This is done by the arterial baroreceptors in the aorta and internal carotid artery. When stretched, action potential is generated and is directly proportional to the pressure change, resulting in negative chronotropic and negative entropic effects and decreased vasoconstriction of blood vessels. Hence, this will cause increased blood pressure and will give a negative feedback to maintain homeostasis. Eccentric reflexes. These play a lesser role in the circulatory regulation but are useful in stress and pain. Pain results in increased blood pressure and heart rate via the sympathetic stimulation. If pain is severe, it can have the opposite effect. Catecholamines are released from the adrenal medulla, innervated by the SNS from the spinal cord. The adrenal medulla secretes adrenaline and noradrenaline into the bloodstream to affect distant organs. The RAA system does not play a major role in health, but rather important in BP maintenance and impaired cardiac output when renal perfusion is compromised. In the lungs, angiotensin 1 is converted into angiotensin 2, which is active by the angiotensin converting enzyme. Angiotensin 2 helps to increase heart rate and blood pressure by stimulating the SNS. Nitric oxide is the most important mediator of vascular health. It diffuses across cell membranes of the endolethal cells of the smooth muscles, causing vasodilation of atrials, thus increasing blood flow and blood pressure. ANP is secreted from atrial cells when the atrial chamber is distended. It directly relaxes the smooth muscles of the blood vessels and inhibits renin, thereby decreasing blood pressure and increasing blood flow. In circumstances where BP causes shock, blood loss, or severe pain, compensatory responses come into play to maintain adequate blood flow to the brain. The baroreceptor causes an increase in cardiac rate. Applications to human health. Bearing in mind the previously mentioned homeostatic mechanisms, one can appropriately choose a drug to block or enhance the effects that it produces, Bruno 2013. An example of this is clonidine being a good drug to counteract noradrenaline secretion from the vasomotor center neural control. As for humoral control, the RAA can be intercepted by ACE inhibitors, decreasing the angiotensin II, which is produced and is active, promoting hypertension. In conclusion, it can consequently be summarized that blood pressure maintenance requires knowledge of the homeostatic mechanisms and the eventuate inappropriate drug usage to maintain normal BP range.